Agnes is going to have an operation on her hip in a week and she's rather afraid. Fortunately, with Sovinty, she can fill in part of her medical record herself at home on the computer, the tablet, or the smartphone with items such as her temperature, her state of health, or any specific need she has. The questionnaire also checks whether she's taken her drugs properly and, if necessary, whether she's fasting or not. And if there is any problem whatsoever, the hospital will be automatically informed and will call her back. Agnes is reassured her operation is very well prepared. Opposite her, Dr. Martin is reassured too. He's got all the information he needs for the operation. It's all been keyed in and checked. And that's as much time saved and even more safety. And he gives her the indicators that she's going to have to use when she goes back home. She can tell him about pain, bleeding, and side effects. The system automatically transfers this information to the health care establishment, and a warning message flicks up if anything looks suspicious. Agnes is then called back by the doctor and her post-operative follow-up will be adapted. All the information and the decisions concerning Agnes are tracked and registered in her medical file. For the hospital, the follow-up is improved and simpler, and the doctors can allow their patients to go back home in all safety. But it does even more. It also supports the patient once back home with a rehab program on video, which shows her exactly the movements that she ought to do after her operation. Sovinty is a pragmatic system. It's also intuitive and simple to use. 94% of the patients to whom it has been offered accepted it, all generations and all disorders together. So Sovinty is really a system that is going to be a revolution in the connections between the patients, their doctors, and the hospital.